Some of the qualitative feedback included wanting to attempt withdrawal without support, like wanting to do that on their own, not knowing how to access treatment, or actually wanting just to keep using was another barrier. But people being unaware of available treatment options was one. Stigma, lack of support, cost, work commitments, difficulty getting to treatment, waiting lists, and also lack of confidence in treatment effectiveness were some of those barriers. Now, just by looking at this list, we can kind of see with stigma, stigma, cost, work commitments, difficulty getting to treatment, waiting lists, we might start to think, well, hang on, online intervention should help address some of those issues. And these authors do actually, in their discussion, refer to the use of online interventions and suggest that it might be something to look at. And I guess that's what we had thought as well originally, was sure, online, it's so convenient, this must be the way to go. When they looked at, so with the amphetamine users, they sampled 126 amphetamine users, so it's a decent sample. They sampled 24 health professionals though, so that's a much smaller sample. But they did find some additional barriers mentioned. So from the perspective of a health professional, they found that limited funding was an issue. Again, they said that clients were unaware of treatment options, that there was stigma as well. They also suggested poor interagency coordination, lack of a unified treatment approach, inadequate case management and follow-up, and limited availability of services, including waiting lists. So some of that's referring more, I guess, to funding and resources and number of staff and those sorts of issues as being additional barriers. So we looked quantitatively as well as qualitatively, and we also looked not just at the barriers, but also at attitudes towards the internet and attitudes towards online treatment, just to kind of, I guess, try to fill that gap in understanding.